Hmm. Let's discuss interviewing, this time the disease history. We must ascertain how and when a disorder arose to get an idea about its etiology, which will help us to reveal which patterns of imbalance can have initiated the disorder and which imbalances can have arisen as a consequence of it. We must ask the patient how long they've had the symptoms and whether the symptoms appeared suddenly or slowly over a period of time. A disease or symptom that develops slowly and gradually usually occurs due to a deficiency condition. An exception to this is blood deficiency. Blood deficiency can arise when there is heavy bleeding, such as there is in childbirth, for example. An excess condition will often result in symptoms that appear suddenly or over a shorter period of time. This therefore means that acute conditions are usually excess in nature. Chronic disorders will almost always be pure deficiency conditions, or more commonly, combined deficiency and excess conditions. A condition that starts as a deficiency condition can easily develop an excess aspect. For example, liver yin deficiency can also begin to manifest with ascending liver yang, while spleen deficiency will often result in dampness, to name just two very common examples. Conversely, an excess condition can easily develop into a deficiency and deficiency excess condition. Extreme heat, such as in a febrile illness, can injure yin. Blood stagnation can result in heavy menstrual bleeding, which then leads to blood deficiency. Inquiring about how the symptoms themselves have developed and how they have changed will also give you an idea of the nature of the disorder. Symptoms that rapidly change are usually more yang excess in nature, whereas yin deficiency symptoms tend to develop more slowly. Inquiry should also be made into the circumstances surrounding the onset of symptoms. How was their life at that time? And were there any changes in their life in this period? Had they started taking a new medication? Did they have a febrile illness? Were there any significant climatic influences? Was there crisis in their relationship or a change of employment? Or had they made dietary or other changes in this period? The answers to these questions will give an idea of the etiology of the disorder. If we know what the etiology is, we will then have a good idea of the imbalances that may be present. The patient's medical history is also relevant. What disorders have they suffered from over the years? Knowing this will give an indication of whether there is a particular pattern and whether the current situation could be a part of this pattern. A severe febrile illness could have weakened their yin or qi, or it could have generated phlegm. A gastrointestinal ailment that they picked up in India 10 years ago could help to explain the presence of damp heat in the lower jaw and spleen qi deficiency. It is vital that the patient is asked about what makes their symptoms better or worse and when the symptoms occur. This requires the memorizing of which etiological factors can create which patterns of imbalance. The following examples are presented to give an idea of this way of thinking and are far from comprehensive. A condition that is adversely affected by dietary factors is usually a stomach-spleen imbalance, but it could also indicate the presence of phlegm, damp heat, heat, cold, yang deficiency, or yin deficiency. If the disorder is affected by climatic influences, then one or more of the six forms of exogenous pathogenic factor will be involved. It can, though, also indicate a lung disorder, weight deficiency, or the presence of internally generated dumb phlegm. If the symptoms are provoked by activity, then it is probably often a blood deficiency condition, while an excess condition usually improves with activity. This, though, is just a rough rule of thumb. A deficiency condition can, for example, result in a stagnation, in which case the patient may well feel amelioration immediately after activity, but the symptoms or the general condition will usually feel worse later on in the day or the day after. The reason for this is that the physical activity will help to circulate qi, but will at the same time consume their qi and blood, so the condition will deteriorate in the long term. Conversely, blood stagnation can manifest with a strong, sharp pain when a joint is activated or extended beyond a limited range of movement, but will be less painful when the joint is at rest. Stress can create stagnation of liver qi, generate heat in the body, and injure yin. This means that symptoms that are exacerbated by stress can be manifestations of these patterns. Emotional influences that provoke or exacerbate a disorder will indicate an imbalance in the organ that relates to these emotions. Certain symptoms arise at specific times during the day. Symptoms that come later in the day or in the evening can be a sign of a deficiency condition. If they come in the evening or at night, it will often be yin deficiency. Symptoms that are related to certain hours of the day can also be interpreted through the Chinese horary clock and whether an organ or channel is at its peak or ebb during this period. Blood stagnation symptoms are often worse or manifest at night when blood is not being circulated by physical movement and activity. This is typically seen in joint pain and traumatic injuries. Symptoms that are worse in the premenstrual period are often related to liver qi stagnation, and symptoms that are worse immediately after the menstrual bleeding are more typically seen when there is yin deficiency or blood deficiency. It is also important to determine whether there are other symptoms that arose concurrently with the symptoms or the disorder. As the more symptoms that relate to a certain organ, the more likely it is that this organ is directly or indirectly involved in the present imbalance. So to tabulate, we have here the symptoms and significance. Symptoms that have arisen gradually are usually a deficiency or a deficiency excess condition. Symptoms that have arisen suddenly, generally an excess condition, but can also be a deficiency condition. The symptoms that have changed rapidly, usually a young or excess condition. The symptoms have changed slowly and gradually, usually a yin deficiency or a deficiency excess condition. Thank you for your attention.